On day 12, I headed north to visit the work of Junlep. At the inpatient ward in Junagadh was Ram Avatar. Although cured of leprosy, he still suffers from claw toes and claw hands caused by the disease. He is currently receiving preoperative care before undergoing reconstructive surgery to restore his hands and feet to normal function. Someone who has already had the same operation is Bansing Maggi. Before the surgery, due to the damage in his hands and feet, he was unable to continue his work as a manual labourer. Although also completely cured of leprosy, these outward signs of the disease led to problems with his neighbours. They would not wash in the same place as him or drink from the same well. When his wife suffered the same treatment, he refused to be seen in public with his family, isolating himself to protect them. After his reconstructive surgery, Lepra provided him with an SER, or Social and Economic Rehabilitation, interest-free loan, to start a more appropriate, less physically demanding business. He eventually plumped for 2 milking cows, and from selling their milk has expanded his herd to 9. He is now self-sufficient and provides for his family. With lepra counsellors educating his village about leprosy, and the visual signs of the disease eradicated through surgery, the exclusion he and his family suffered has come to an end. I then went to the village of Chingudisar to meet cured TB patient Pramila Pradhani and her DOTS provider, Subhamani Pal. DOTS stands for Directly Observed Treatment. In this scheme, a volunteer is selected by Lepra to supervise the treatment of TB patients unable to access centralised healthcare. The medication is kept at the home of the DOTS provider, and the patient is given a timetable of visits to take the medication. The DOTS provider ensures the medication is taken in the right way and at the right time, tracks down the patient in case of any missed appointments, and ensures the course is fully completed. The DOTS provider is also given education on spotting the symptoms of TB. After Mrs. Powell passed this education on to her patient, Mrs. Pradhani's son referred a member of the village for testing. When the results came back positive, he volunteered to become their DOTS provider himself. I then went to see the mobile low vision clinic, which was providing eye tests at the Kanyasaram High School. If a child is diagnosed with vision problems, they can be given free glasses on site, vitamin supplements, or even referred for surgery. One child who was referred for surgery is 7-year-old Surendra Hattie. The Low Vision Project educates parents and teachers on how to spot early signs of vision problems. After noticing Surendra was struggling to read, a teacher at his school sent him for testing. He was diagnosed with congenital cataracts in both eyes and successfully operated on. On day 13, I continued the vision theme when I travelled to see the work of Bolep at the MNC Eye Hospital. Waiting to go into cataract surgery was 69-year-old Mathura Amat. 4 days ago, Bolep's own low vision clinic travelled to Mrs. Amat's village and announced there would be a free vision screening the following day. The message was also spread through local community leaders. After attending the screening, Mrs. Amat was diagnosed with cataracts. A counsellor advised her that she could have a free operation to restore her vision, and she was taken to the MNC Eye Hospital the next day. She received 2 days of preoperative care and examinations before being operated on today. Before the operation, she had been living with low vision for 4 years. She found it hard to do anything around the house and even needed help going to the toilet. Tomorrow morning, the success of the operation will be assessed. She will be given eye drops and advised how to look after herself before being sent home. In 1 week, she will come back for a follow-up to see if, as hoped, her vision has been fully restored. At the end of day 13, I became quite violently ill, so on day 17 I travelled down to the state capital of Orissa, Bhubaneswar, to see the work of RRR. I visited a targeted intervention project for intravenous drug users. Outreach workers run monthly focus groups giving education on safe sex, needle sharing and overdose management, as well as distributing condoms, sterilised needles and substitute drugs among the group. By providing substitute drugs, they can wean users off the mixtures of tranquilizers and painkillers they would otherwise be taking, in a controlled way, gradually reducing the amount and helping them get clean. Although these meetings are currently held where the drug users congregate, in this case the cholera ward of an abandoned hospital, in the future the project hopes to liaise with government and police to establish a centre where users can come and receive substitute drugs in a safe and supervised environment. On day 18 I caught the train from Bhubaneswar to arrive on day 19 back in Hyderabad. My last visit was to the Blue Peter Research Centre. In the immunology and microbiology departments, teams of researchers conduct studies into various diseases with the aim of aiding the search for improved targeted treatment. I saw research into early detection of nerve damage in leprosy patients using ultrasound. The researcher had found it can detect nerve damage 2 months before conventional nerve function testing. With early detection comes early treatment and prevention of disability. I saw work on creating a geographical map of where different drug-resistant strains of TB and leprosy occur in India. There is also research into TB-HIV co-infection that looks into how the genes of each patient affects how susceptible they are to particular strains. With this research, treatment can be targeted to high-risk groups based on location or genetic makeup. I also saw research into the regulatory system of TB bacteria. There is a gene within the TB bacteria that either lets iron in or out, depending on the levels of the host. If this research can isolate this gene, it can develop treatment to target and disrupt this function, so the bacteria will not survive inside the human body. The researcher I spoke to said it would take more than her lifetime's work, but she's still going to try. On day 20, I went home.